Dr. Sanjeev Gulati, Principal Director, Nephrology and Kidney Transplant, Fortis Group of Hospitals, NCR. Today, I'll be talking to you about the super drugs for diabetic kidney disease. Studies have shown that 1 out of every 2 diabetic patients in our country has chronic kidney disease due to diabetes. Kidney disease is a silent killer. Most patients with chronic kidney disease develop diabetic kidney disease over a long period of time. However, it is silent. The only way to diagnose kidney disease early is either for doing the urine microalbumin creatinine ratio or by doing an eGFR estimation. Now, the day they develop diabetes, these patients have certain pathophysiological changes at the nephron level. The hyperglycemia that happens in diabetes leads to glycosuria. Along with the glucose leakage in the nephron, the excess glucose is reabsorbed in the proximal convoluted tubule part of the nephron. Along with that, there is also increased sodium reabsorption. That is why most of these patients are in hypertension, they have volume overload. Because of the sodium reabsorption that is happening in the proximal convoluted tubule of the nephron, there is less sodium reaching the macula densa, which is the computer chip that controls the glomerular microcirculation. Because this in turn leads to afferent arterial dilatation, which means the capillary that is bringing the blood to the glomerular capillary loop, the afferent arteriole. As a result of this, there is glomerular hypertension and there is glomerular hyperfiltration, which in turn leads to glomerular hypertrophy. So this is how diabetic kidney disease starts. Now we have at our disposal the SGLT2 inhibitors, which are really the magic drugs. They block the SGLT2 receptors, which are located in the proximal convoluted tubule, thereby leading to more glucose loss or glycosuria. So that is how they cause euglycemia. Now, once there is the blockage is there of the SGLT2 transporter, the sodium 2 is leaking in the urine. Because of this, there is more sodium that reaches the macula densa, which in turn signals the afferent arteriole to constrict. So there is reduced blood flow, there is reduced glomerular hyperfiltration, there is a slight fall in the eGFR, and there is actually reversal of glomerular hypertrophy. So this is how the SGLT2 inhibitors reverse the pathophysiological changes which happen the day you develop diabetes. They have a lot of other beneficial effects. They lead to, because of their diuretic-like action, they lead to better BP control. There is also improved glucose control. There is better oxygen utilization in the proximal convoluted tubule, and so there is overall there is better kidney preservation or preservation of the eGFR. At the same time, there is also beneficial effect as far as the cardiovascular benefits are concerned. So it's a buy one get one free. And these pathophysiological changes that I showed have clinical connotations and several trials now. The Credescence trial, the EMPAREX study, and lastly the DAPA-CKD study have all validated that there is a significantly lower risk of composite kidney outcome, composite cardiac outcome, better preservation of GFR, and improvement in the albuminuria also. So truly, the SGLT2 inhibitors are the super drugs for managing diabetic kidney disease. And I would like to thank the organizers as well as the Wockhardt group of companies for organizing this excellent overview. Thank you.